I thank you so much for making time that you do not have right now at this moment, just to have this conversation to bring awareness to not only the tribal nation of the Navajo, the Dene, but also to update us all on just how COVID has been, how your tribal nation has been reacting to COVID-19, how you as a physician are viewing your people and your nation, and what you think is the call for action that we will need, obviously. But I just want to start by saying thank you and getting to know a little bit more about you, because you sound to me like an extraordinary person.
Well, I appreciate words, and thank you for hosting. It's amazing, and for Liberatum, it is such an honor to be on a platform such as this, and to get the story of the Navajo people out there. And so it's just huge for us, as myself as a Net person, and for our nation and all the Native American tribes in the United States and North America, actually. So thank you for having me on.
Thank you, thank you. And I just want to start by just having a little bit of a history on you. I know that you grew up in the southern region of the Navajo Nation, and after your medical training, you returned home to practice general, family medicine. And now you've been transitioning and working in the ER rooms of two facilities right now, simultaneously with all the COVID-19 patients that are arriving. And how are you?
I I can't downplay the mental, physical, and spiritual fatigue of this. And not this just myself, but for all of the fellow people who are literally on front lines, the nurses who are taking care of the patients, the ER docs, urgent care, the hospitalists, the ICU nurses and docs. Like, it is something that I believe all of us have never really probably thought in, something like this in the United States, right? Because we're a first world country, we have the best healthcare. For it to become at this level for us right now, and it's hard. Initially you have all this energy, but now we're literally into 3 solid months, and it's not slowing down. And initially it was okay, but now it's really mentally, physically, and spiritually draining, and doesn't seem like it's letting up. So I think there's a call for people to check on our first line workers. I feel myself that I'm a pretty strong individually, mentally and spiritually, but I have it come in waves. So that's how I'm doing. Overall, I can't say too much because I'm healthy. Yeah. I have great family and friends. So above all, I think I'm just blessed to be in this position now. And yeah, can't too much into much more than that. So.